So what's the difference between a classic headache and a migraine? Well, there's several kinds of headache. Neurologists are the specialists that know a lot about headaches. They can give you a classification. But you know, in general, headache goes away and is sometimes continuous. Migraine is usually related to vision problems, nausea, and it's a disease that affects the whole brain. So you have migraine, but it's not away the next day. You still feel bad and you still are grumpy. So it's completely different than a normal headache. Can we treat migraine? Yes, we can treat migraine with medicine. There's really good medicine out there and they're being renewed all the time. But in some cases they don't work, or the frequency or severity is just too high. And then there's also other options which you could try. For example, botulinum toxin, which can be injected around the nerves and is taken up by the nerves and transported to the brain. It's been proven that that works, so why not give it a try? And there's also something like surgery, migraine surgery. It works especially for continuous tension headaches in this area, but also in the neck. There's been a lot of research about it, and it is also shown that it will reduce the severity and frequency of migraine, in the sense that they think now that migraine can be triggered on the outside, although it is a primary brain disease. So what we do is we free up the nerves which are encased in the periosteum, which is the fascia which is feeding the bone. When you free that up, they pop up and suddenly they can be without a headache, whereas they had headache for almost every day in the time before. Is there a possibility to do surgery for migraine? Yes, there is. BOTOX is an option because it's taken up by the nerve and transport to the brain. There's a Cochrane study about it, that it's in a randomized control study that it helps. So that's not an issue anymore. But also surgery has been proven to work in cohort studies, that like series of patients where you do the same thing. The idea behind it is that you free up the nerves, which could be a peripheral trigger for the primary disease in the brain, which is migraine. And also that has been shown to work. So there's, for migraine, there's medicine, there's BOTOX, and there's surgery. You know, you always start with the most simple thing, which is medicine. So go to your neurologist and see if they can help you. Whereas you can also, of course, be treated by the family practitioner. Then there's BOTOX, which is done in specialized centers, for example, in our center. And then there's surgery, which you can try because the effect of the surgery can be extremely big. And the chance of a complication is very small, because what we do is we make a small incision here. We go with the camera towards the nerve, we free up the nerves. In this area there's nothing that you can harm except getting a hematoma, and then you go out again. And when you wake up, suddenly the headache can be gone. And when you free up those nerves, which are continuously under tension, you also see that patients are suffering less from headache, and sometimes it will disappear completely. So you see patients which have a headache for years before the surgery, and after the surgery it's gone. And it's for us as surgeons, it's a procedure with little risk, because for example here there's almost no risk for damage, whereas the result can be huge. They go from a 9 to 10 on a visual analog scale to 0. Look at the patient videos on our website. Sometimes it's just incredible. So as a surgeon, these are the best patients. They come in with something very severe. You do something which is kind of easy, and they go out with completely no complaints anymore. Why not give it a try?